Welcome to Roadmap to Residency, Evidence-Based Applications. In this video, we will be talking about disease surveillance methods and data collection. So public health surveillance or disease surveillance is an ongoing systematic collection, analysis, and interpretation of outcome-specific data for use in the planning, implementation, and evaluation of public health practice. So in the surveillance system, there are main three determinants: data collection, the analysis of data, and then the dissemination of data or results. So surveillance for communicable disease remains important. The world population is highly mobile. International travel and troop movements uh, increase the risk of communicable disease transmission. Migration for war and feminine and voluntary immigration increases the communicable disease risk. Naturally occurring disease is not our only threat. So the most important of all the factors of all the diseases is the surveillance for communicable diseases, because it spreads faster, okay, and there is rapid movement of population throughout the world, okay, and that's how the COVID-19 spread so fast. Within span of 2 to 3 days, it was actually all over the world. Now, what are the elements of surveillance? Now, cases and deaths due to a given disease, lab results, prevention and control measures, environment, vector, reservoir, and the total population at risk or affected are the different elements of surveillance. Now, what is the conceptual taxonomy? So, public health surveillance, we can have medical utilization and adverse events, which contains drug, vaccine, and other products or services. Or we can go towards disease, where it can be traditional, like infectious disease, or syndromic diseases. Or it can be some other diseases like birth defect injuries or some other non-communicable diseases too. No, no, we are doing public health surveillance, we are doing disease surveillance, but what is the main objective of surveillance? So the main objective of surveillance is to identify disease of public health importance, identify quickly any outbreak, epidemic, or unusual event, identify risk factor, identify high-risk population, monitor disease trend, access current disease control activities. So when you go for a disease surveillance and you find out that this disease is very prevalent and may be a communicable disease, may transmit to other people very easily, and then you know that this disease is a disease of public health importance. Also, if for example, there is a case of any one COVID-19 in a community, then if you know the idea of disease surveillance, then you can finally trace the diseases and you can quickly identify if there is any outbreak, epidemic, or any unusual event that is happening. When you are doing surveillance, you also know that this specific risk factor will cause this specific disease in this high risk population. When you go towards disease surveillance, you can also know that the disease trend. For example, some influenza may be happening in fall, some may be happening in December, some may be happening in January, and then you don't know the disease trend. So for the next year, you will be ready for that disease in that particular time of the year. And as we have talked in the previous slide, we also talked about the preventive and medical factors. You can also access the current disease control activities that are happening for that specific disease. What are the different types of surveillance? So the number one type is passive surveillance. Now, passive surveillance is an inexpensive provider-initiated surveillance. It is good for monitoring large number of typical health events, and the underreporting is a problem. For example, if we report a case from the hospital, then that is called as a passive surveillance. Whereas active surveillance is when we generally deploy people for the purpose of surveillance. That is called as active surveillance. It is more expensive. The health department is involved, and it is initiated by the health department itself. It is good for detecting small numbers of unusual health events. Enhanced surveillance is the rapid reporting and communication between surveillance agencies and stakeholders. It is best for detecting outbreaks and potentially severe public health problems. Now let's talk about data collection. Okay. Now, number one is the routine reporting system, which is they're involved in the hospitals, healthcare centers, health facilities, and in between the community health workers. The advantage is that it is inexpensive, efficient, and standardized. And disadvantages is that it is incomplete, and due to the busy doctors and nurses, there may be under-reporting of the data. Remember, when you are working in a hospital, you are reporting the number of cases, the number of MI cases, the number of pneumonia cases that are coming throughout the day, throughout the week, throughout the month. Okay, that is a routine reporting system. New and complex disease entities must also be monitored. For example, new syndromes may emerge that present in an atypical manner. Syndromic surveillance uses health-related data that precede the diagnosis and signal a sufficient probability of a case or an outbreak to warrant further public health response. For example, there is one case of a patient coming with severe shortness of breath and flu symptoms, right? Now, if we have a syndrome associated with that, okay, if you have encountered the same disease in the past, then you know that then you know that the progression of the disease, okay, you know the progression, you know the prognosis of the disease. Now you can sufficiently say that, okay, now this may take a form of outbreak, or this may um, be a disease of public health importance. Okay, for example, dengue. Okay? Dengue in some sort of community. Now that is a specific example of syndromic surveillance. There is a Sentinel reporting system, which is used only in the selected health units. The advantages is that it is more consistent, um, uh, and it gives a more consistent results, and and it is a motivated sort of Sentinel reporting system, because we are only selecting some sort of health units. We are only focusing on one particular area. The disadvantage is that it is not representative with a whole population. Surveys and special studies. It is a broad estimate. It measures the reliability, and it relieves the healthcare workers, because we are actively using surveys. We are actively using people only to do the surveys. Okay, and the disadvantages is that we need a large sample size, and it is very, very expensive. So case and outbreak investigation. So on occasion, it is used as a next step. Now, so data collection requires training, supervision, quality control, and reporting. And then after collecting the data, we need to analyze the data, where we make summary tables, we make disease chart, we make maps, rates and ratio, we calculate that, and we cause more analysis for pattern and causes. And then we investigate the causation of the disease, the case and outbreak investigation. So we do a verbal autopsy, that we discuss and we find out where did the problem happen. Now, this is an example of a foodborne outbreak investigation. Now, first of all, we need to detect first, is it a possible outbreak or not? Then we need to define and find the cases. We need to define, okay, the people with these sort of symptoms are our cases. Okay, we need to define first the cases. Which sort of symptoms do we define as a cases? And then we need to find those cases. After that, we need to generate a hypothesis. Okay, so hypothesis generating interviews are there. After that, we need to test the hypothesis. It is through analytical studies and lab testing of samples. After that, we need to find the point of contamination and source of food. Then we should go towards controlling the outbreak. We need to recall the products. We need to cancel the food. We need to remove the source of contamination, and we need to revise the production process. If the cases stop, then we need to uh, decide if an outbreak is over. Thank you for watching. Keep studying.